Why did I do that? No, not at all. Y'all see my little get up shorty? This was back when I was yamming. For real. Dr.Dawta is here for you guys. I am here. Last night was crazy. So, you know, I did a little something, not too much. But I told you I was fitting to come back today. So, welcome to the chat, everybody. Welcome. Welcome. Now, let me explain something to you guys. I cannot make this up. If y'all believe it's fake, I will give you the website. You can go look it up. I will even spell it out for y'all. But honey, these are some real life symptoms. I didn't know this shit was going to happen this way. But y'all, this is some real shit. Now, normally I would say, who shall I diagnose first? But because I'm feeling a little, want to laugh and, you know, geek just a little bit, not too much. First and foremost, because it feels real good outside. I want to get this done and over with so I can go outside. I don't want to be sitting on here too long. Give me 1 second, because then I just switched somebody. Okay. Alright. I guess he meet that part of it. So, let's see. Who do we have here? We have ZT, Deanna, Wiley, Tracy. I would do the whole sector for y'all. Oh, you changed your name? I have Brianna. And Rick Reed. Not too sure of how many I'm going to do. I'll probably just give y'all a little taste, maybe 2. You choose. Dr.Dawta is here for you guys. Okay, she is here. I'm willing to give you everything that you need. Everything. Yes. Give me a second. Alright, I'm back, you guys. I'm in a little cut for real. Got things around me. Perfect spot to do this. Now, first and foremost, only because I found it funny and I just, you know, I had to go see what it was. Normally, I go and kind of, let me show you how I do it. We're going to do, let's do Deanna first. What I do is, good morning. I go and type in, if y'all want to do it, y'all can do it too. Go type up syndrome for people who doesn't like to wash. I cannot make this shit up, motherfuckers, okay? Listen. I cannot make this shit up. I'm going to read it to y'all. I cannot make it up. Peep game. I cannot make this up. This is what I do. Okay? I didn't know this was going to hit on a motherfucking nose, bitch. But my shit is real, okay? It's called ablutophobia. Okay? It's the fear of bathing, cleaning, or washing. It's an anxiety disorder. This phobia can disrupt your life. If it's more common, it is more common in women than men. Okay? You can't make this shit up. Okay? Most people with this phobia know that they fear is not realistic. Those with this phobia are scared of washing, bathing, and showering. Everyone knows that bathing is a vital part of life, social and medical. Reasons people with this phobia, it can be very terrifying. Children tend to develop this phobia between ages 7 and 11 years of age. Symptoms and complications is lack of washing, which have important consequences. Most prevalent symptom is fear. Fear of water. Technically, people are fear of fucking water. Yes. Now, normally it lasts for maybe, 6 months, but I don't understand how it's lasting this long. Chill, you should have been over this. Physical symptoms. You can't make this up, okay? Physical symptoms. Racing pulse, difficult breathing, feeling faint, heart palpitations, sudden sweats, dry mouth, nausea, feeling disconnected from reality. Okay? Those who has this avoid triggers, avoid bathing and washing. Consequences, getting in trouble at work or school, become socially isolated and depressed. Okay? Treatment. We're going to give her some treatments, okay? Therapy. We have exposure therapy. Y'all all know what exposure therapy is. Exposure therapy is being exposed to the water. Exposed to the soap. Shit. Here, Brandy called. Exposure to the water, exposure to soap, exposure to a rag, exposure. We have to expose her to these things. For y'all to sit here and allow this lady to be as dirty as she is, y'all ain't no motherfucking real friends. I'm just going to explain that to y'all here.
Hello?
I'm so serious.
Yeah.
Okay, well, see, did I hit it on the nose, TT? Boop. Type of medications, she need anti-anxiety and, antidepressants. I'm not telling you to take my advice, but if I were you, I would take my advice. Next. Don't drag me for this. I'm just doing my job. This is only for, educational purpose only. Absolutely it is. I don't want no smoke. They asked me for the doctor to come back, and doctor came back, okay? What I'm saying is you got to take your hand, dip it in a cup of water, and splash it on her face. She can't just go outside and just go in the rain. If she go in the rain, then she be... If she go in the rain, that's too much of an exposure, Don't expose her that much. Dip your hand in some water and splash her. Because, honestly, she can't be washing no motherfucking dishes if she's scared of water. Okay. Next up, we're going to save that ass for last. Okay. Now, I have found out. No, feet. See, you're not understanding. When you step the feet in, it's too much of an exposure. It's too much of an exposure. You feel me? You going straight go in. You can't straight go in. Because once your feet wet, you got to get all the way wet. Okay? Once that foot is wet, you got to go all the way in. You can't stop. There's no reason to stop. That's like jumping in the pool. Jumping in the beach. Once you wet, you got to go all the way in. To expose somebody and start exposure therapy, you gotta dip, splash. Take the wash rag and wipe your face. That's how you start it first. I'm just trying to help you. Don't take it. Don't come for me. Okay. Now, Tracy, y'all can follow me with this. I want y'all to go type in, and I did not know this was gonna hit on the nose, honey. But chill, this hit on the nose. If you want, you can go and type in cracked tooth syndrome. Okay, I'm gonna follow y'all with this. Just know it's written down over here too. But I'm gonna let y'all know cracked tooth syndrome. I'm gonna give you a picture first. Okay. Now, okay. We ain't fucking sinned. They have sinned. Okay, now, peep game, there's different types of cracked teeth, but I'm going to give y'all the reason this girl has a gold tooth in front of her mouth, okay? This is a cracked tooth. You see that? Right there? That's a cracked tooth, okay? Cracked tooth. Now, a cracked tooth has incompletely cracked, but no part of the tooth has yet broken off, also known as green stick fracture. It could be considered a type of dental trauma. Okay? Symptoms is normal teeth. She let it happen. Didn't get it fixed too fast. So, the symptoms is sharp pain, rebound pain, pain when grinding teeth, pain when eating or drinking sugary substances.
Y'all cigarette, can I have one?
Don't come over here messing with me. I'm in the doctor's office. You don't ask no doctor for no cigarette doing no doctor.
Excuse me,
You want to come into my doctor, sir? Here you go.
Thank you.
Here's a lighter.
I got one of those.
Yes, cracked tooth syndrome. Okay. A clinical diagnosis, clinical examination, meaning clinical signs which may lead to the diagnosis of CTS, including wearing facing to prevent clenching or grinding of the presence of the tooth. So, it says the causes previous restoration procedure, patients who suffer from clenching teeth, trauma, aging or presence of lingual tongue studs. Okay. Treatment. Now this is where it hit on the nose, Treatment, stabilization, a compass bonded restoration placed in the tooth or a band is placed around the tooth to minimize flexing. Y'all think she on here flexing that goddamn gold tooth for no motherfucking reason? Bitch. Crown restoration. That is what it is. It's a permanent crown because her goddamn tooth is fucked up under. Okay. Her tooth is fucked up under. It say it does the same as stabilization, but it is more permanently and predictable. She didn't want to get a root canal, and she didn't want to get it extracted because she didn't, want that. She would look like Lady Nika if that bitch was gone. Okay? She didn't want that. So she was like, just put a cap over top of it, and I'm going to be like, bling, ooh. And that's what she did. Got the shit out of me. But I thought I should let y'all know. Now, that's on there. Is your teeth like that up under there, though? My uncle got one, but I thought it was cute, But I feel like that's the reason. That's why, but see, y'all must understand, when you get that crown, the crown does not belong bigger than the other tooth. Okay? If it was even with her tooth, it would cause a problem. But because it's not even, it stopped it from grinding. It stopped her from clenching. Maybe she clenched when she cold. Or maybe she eating a lot of shit that she does not belong eating. And drinking shit that she don't belong drinking. Like the motherfucking 2-liter sodas. I'm just trying to help y'all out understand what, what's going on these streets. See, everybody sit here and pick who to fucking beef with, who to talk about, and always want to make it seem like something wrong with somebody when all you bitches got something wrong with y'all. Okay? And I don't want no trolls to come up in here, because then I'm going to start diagnosing trolls. And I don't need to know you to start diagnosing you. Okay? Okay. Next. Y'all want to see her teeth again? I mean, it's different reasons she can have the crown, but trust and believe me, it ain't because she trying to flex. That bitch is flexing up under that motherfucker, so she had to hold it in place. Okay? I got a lot of people I can do. I just wrote down a certain ones. Okay. Yes, it is. Well, I don't really know if I want to do that one of the forehead, because I found out what's wrong with her goddamn. Matter of fact, fuck that. Okay, we gonna diagnose. Walk up in this motherfucker. Okay? You can't make this shit up. Trust me. They always say you can't be. Alright now. Alright. I got y'all. I'm gonna find out what's wrong with her fucking forehead. I don't know if this is it. Give me a second. Okay. It's called a cutaneous horns. It's what it's called. See, it's not too big and it's not too small. That's why she always take her hand, swoop it over. I got y'all. Listen to the doctor. Okay, listen to the doctor. The doctor got you. Now, I'm going to show y'all a picture. This is what it look like. And it's only dark because she chooses to put makeup over top of her motherfucking skull, over top of it. So it's infecting even more. And if I'm wrong, Tracy, just, come on and just move the shit to the side. But you may want to go get that shit checked out, because that shit ain't cool. I'm trying to help y'all. Okay? Don't come for don't come for daughter. Do not come for me. Okay? Alright, you said check out before. Alright. I'm going to check that one out first. Okay? Don't come for me. I'm trying to just help y'all out. I am passing on the message since, y'all motherfuckers had to come to the doctor's office. Y'all was on here going the hell off last night. Don't tell me it's the same goddamn thing I just looked at, yo. Oh, yeah. Hold on. It might links up. I'm just doing my job. No, I like mine's better because I think it's a joke. I'm be honest. But, and I don't know. I don't know. I'm going to be honest with you guys. I don't know. Because it's just under the skin and move easily when pressure is applied. They commonly occur in the neck, shoulders, back, abdomen, arms, and thigh. Nope. She don't have that. Let's go back to where I had. Alright now. This is what looks like on her fucking head. And she just put stuff over top of it. Makeup. And then she take her little hair and she swoop, swoop, swoop. I'm just saying. I'm just doing my job. Yeah, I find it funny. I'm doing my job. It says, this horn appears as a funnel-shaped growth that extends from a red base on the skin. It is composed of compacted keratin, the same proteins in the nails. Okay? This size and shape of the growth can vary considerably, but most are a few milliliters in length. It usually occurs in fair-skinned elderly adults with a history of significant sun exposure. Tracy, sounds like you. Sounds about you. I'm just doing my motherfucking job. Might be skin cancer, bitch. You need to go get that checked out. I'm doing my job. Don't get mad at me. You need to go get that checked out. And exactly, Texas has a lot of sun. So, all I can say is, the first time I came on here diagnosing motherfuckers, I was right. You need to go get that checked out. Let me see. Okay, I'm waiting for it to load. We're going to go do the signs and symptoms for this motherfucker, too. They going to be mad at me like I did something fucking wrong. Like I did something. Nobody said she was a white woman. This don't only occur in white people, okay? It doesn't only occur in white people. No, sir. Don't be texting me. This skin condition is more common in older adults, and both men and women can have it. It can be benign or non-cancerous, but they can also be precancerous or cancerous. Symptoms: looks like a growth on the outside of the skin. This is the most common symptom. It can appear as a large bump, cone, spike, or horn. Okay? The growth may be the same color as the skin, or it may be a different color of the skin. The color of the growth can vary. White, pink, yellow, tan, brown. Most cutaneous horns are curved, and the curvature can get worse as they grow. Okay? I'm just saying, I'm doing my job. Let the kid do her job. They are usually seen on the what? Face, hands, ears, head, chest, arm. Areas of the body that are exposed more to the sun may be more likely to have these growths. Okay? Absolutely. I does my research, my job. Let the daughter do her job. The exact cause of this horn is often unknown. Exposure to the radiation from the sunlight may be one of the causes. Another possible cause is having viral warts caused by HPV. So you got HPV. I'm shocked. I ain't playing with her. Whether this bitch black, white Mexicano. The bitch still got the horn on her forehead, and she need to go get checked out. She needs to go get checked out. I'm giving you the message. You just do what you choose to do with it. Absolutely. It says that about half of the horn, half of it can appear on the top of or because of the skin cancer or precancerous skin lesion. Others may appear on top of or because of burn scars or non-cancerous skin conditions. So, did you fucking burn your fucking forehead trying to straighten your goddamn tracks in the front, bitch? And how old is you, Tracy? Do I need to look up unicorn syndrome? I swear to God, y'all motherfuckers don't understand what the fuck I be doing. Listen. It's a complication. I'm going to do unicorn syndrome for y'all. Okay? Complication of a cutaneous horn. Pain and inflammation are possible if the cutaneous horn is injured. It may be a sign of cancer, bitch. So it's important to call your doctor. Go and see your doctor. She what? $49.50 in November? Okay. Go back up. Go up. So if you when you need to go see your doctor if it's a new horn that developed, pain and inflammation in your horn, redness or bleeding of your horn, rapid growth of the horn, hard or thickening skin at the base of the horn. Okay? I'm even convinced that this shit on your forehead is a goddamn horn. Okay? You're gonna need a biopsy. You know? Treatment of getting the horn removed. You know? You have to get it removed of removing the growth, freezing the growth with liquid nitrogen, scraping and burning of the growth. Do not do this shit at home. Do not do this shit at home. And that's only if it's a non-cancerous one. So you know you got to get a biopsy and all that. But does not do this shit at home. You keep on slapping goddamn makeup on it. And this motherfucking infecting it even more. You know? Or did you get your horn removed and it's a scarring up there? Bitch, I don't know. I'm just trying to do my job. You may not know what it is, but I'm just going to help you. You better not yank that motherfucker out with no pliers. Don't knock it with the hammer, girl. Don't knock it with the hammer. I'm just trying to help y'all out. Okay? Now, somebody said something about a unicorn. See, if you give me a word, I will look that word up and just put syndrome on the back of it. And trust and believe it's a syndrome. Now, let's see if we got a unicorn syndrome. I know this ain't no motherfucking syndrome. It's a motherfucking syndrome, bitch. I cannot. Chill. Okay, unicorn syndrome. Think I'm lying? Y'all think I'm lying? You can't make this shit up. You cannot make this shit up. Okay, I am fucking dead with y'all. Unicorn syndrome. I know, me too. It says unicorn syndrome explains the thought patterns people go through in recovery. Now, let me make that smaller. Okay. The unicorn syndrome is a syndrome or delusion that commonly occurs among people in recovery, whereas the sufferer believes they are different than everybody else in the recovery, and that generally guidelines, explanation, and advice in recovery does not apply to them. Google be doing too much, but you can't be done with a smartphone, you know? Okay, something that is particularly noticeable and special about the unicorn syndrome sufferers is that they are usually able to give others advice on their recovery problem. That sounds like Daughter, don't it? Okay, yet when the sufferer explains the exact problem, the advice does not apply to themselves. This shit don't apply to me. It does not. So, before you bitches diagnose me, let me diagnose myself. I'll take this unicorn syndrome and run with it, okay? Because this shit doesn't apply to me. Me doing this shit for y'all, the syndrome is especially visible in the recovery community on social media. Oh my God. Yes, everybody on motherfucking YouTube got the unicorn syndrome. This syndrome is for the sector. Beef sector alone. Booyah! Okay. The syndrome can result in a ping pong situation. Y'all motherfuckers last night was boom, 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 back and forth. They hit it on the motherfucking nose. Didn't even know this shit was real. Okay. This is This is not my syndrome. Cause bitch, I do not go back and forth with these motherfuckers on here. I don't. It say the syndrome can result in a ping pong situation where two sufferers experience the same recovery challenge and give each other the same advice, yet are not able to apply the same advice given to them. They are usually able to give others advice on their recovery problems, yet when the sufferer experiences the exact same problem, the advice does not apply to them. Meaning, I can give you advice, but bitch, don't give me none. I'm not accepting none of you bitches' advice. Okay? Y'all don't shoot the messenger, okay? I cannot fucking... Oh, so, see, this is how I find my syndromes, okay? And I'm gonna go and write this down. And I only do this shit because I like to learn. Because we're gonna find out what this syndrome is too. Okay, so the unicorn syndrome can easily be confused with its brother, which is the Good Samaritan syndrome, whereas the sufferer provides recovery help and inspiring advice to others with the best intentions, yet don't commit to recovering themselves. The Good Samaritan syndrome sufferer will often write long and inspiring texts on social media about how recovery is worth it, how important it is to challenge yourself and take the plunge, yet the sufferer stays in the same place themselves for an infinite amount of time. They will show genuine care for others, yet forget to care about themselves. I see a lot in y'all. Okay, I'm doing my job. I'm just saying, am I hitting it on the nose again or no? I don't know. Tell me something I don't know. I just thought I should let you know. Okay. Next. Next patient. Okay. Because I found this funny. Okay. Gotta write things down. If you don't know, now you know. I can't believe that the unicorn syndrome was real, though. I just cannot believe it. Now, like I said, you guys, you cannot make this up. All right. Who's my next patient? Now, what is it called? All right. Because again, you can't make this up. Okay. Well, still the same thing. It's called insulin resistant syndrome. Y'all know who that is for? If you know who that's for, let me know. Let me know. Also known as metabolic syndrome. Y'all don't know who that's for? How the fuck you know, bitch? How you know? Stop it. You must. Okay, we got a doctor in the building. Okay, I'm just doing my job. I'm doing my job. Don't shoot the messenger, Brianna. I'm gonna give you your reason on why you won't lose, why you cannot. It's not that you always hungry, or better yet, you always hungry, but it's why you can't lose weight. It's not that you're trying. It's not that you're not trying. Or better yet, I don't know if you're trying, but if you is trying, it's not you, it's your body. Okay? Your body reject insulin coming from your motherfucking food. So everything that you eat, your body already fucked up. It's already fucked up. Okay? You need to change your whole life around, baby. I'm just giving you some advice. Just don't shoot the mouth. I'm going to have to keep saying this because I don't want y'all to think like, oh, she's a bitch for this. Don't think like that. Okay? Do not think like that. Try some shit like this. Oh, nope, this gain weight. You need to lose it. If y'all think I'm lying, I'm going to read it for y'all. Now understand, the only thing I typed in was someone I said syndrome for someone who refused to lose weight. And this is what popped up. You can't make this shit up. If you go type it in, that's going to pop up. Okay? Don't shoot the messenger. Okay? Do not shoot the fucking messenger. Okay? Now, it say metabolic syndrome is a cluster. Now see, normally it would be, no, I don't know, nothing is wrong with me, but Brianna, at this point, I feel like you're lying. You just choose not to tell us, and it's okay because I figured it out for you. And if you don't have it, you will have it, but as big as you is, I'm pretty sure you're on the borderline of diabetes, baby. But I'm going to help you out. And any of you bitches that's her friend that choose not to help this bitch lose some fucking weight, you're a fucked up individual. Okay? But let me read it for you. Okay. Metabolic syndrome is a cluster of conditions that increase the risk of heart disease, stroke, and diabetes. It includes high blood pressure, high blood sugar, excessive body fat, and abnormal cholesterol levels. Symptoms. Besides a large waist, what you got? Most people with this doesn't even know that they have it. Okay? For real. But some people, they experience obesity, overweight, diabetes, high blood pressure, or pot belly. You got all them in that. I see it. I see it. You may not see it, but I see it. Causes is linked to a condition called insulin resistance. Normally, your body, that I'm going to explain it to you if you do not know. Okay, normally your digestive system breaks down the food you eat into sugar. Insulin is a hormone made by your pancreas that helps sugar enter your cells. Absolutely. It enters your cells to be used as fuel. Those with insulin-resistant cells don't respond normally to insulin, which result in the glucose unable to enter cells correctly and easily. Risk factor. Your age, which you're too young for this. So I'm just trying to help you. Consider me your friend. Ethnicity, a lot of black motherfuckers, African Americans, it hits us. So number one, that's two. Two risk factors you already have. Obesity, three risk factors you already have. I'm pretty sure you got diabetes, so that's four risk factors that you have. Complications, increase your risk of having type 2 diabetes, heart and blood vessels disease. In order to prevent this, Brianna, you gotta get 30 minutes of physical activities every day. And I mean every day. Your girl gonna be on ice for 3 years. Give me 100 pounds each year. And I got you, bitch. Okay? Eating vegetables, eating fruit. Lean protein, meaning fucking certain meats. Whole grain. You need to go get that bread and stop fucking playing. Limiting saturated fats and limiting your salt. Maintaining a healthy weight and who that? And no smoking. I'm bitch. I don't think you smoke, but okay. You just need to change your lifestyle, you know. When you go to the doctors, they're gonna measure your weight, which I'm pretty sure you gotta be like 35 inches or less. But if you more than that, you obese for your age. You need a reduced cholesterol. It must be less than 50 milligrams. Say what? That her waist big as a fucking bitch. I don't watch. I'm gonna be honest. I really don't. I don't watch them. Because it's no fun anymore. I just give y'all my opinion and let y'all run with it. I don't really, you know. Now, this shit is killing. Now, I will do Wiley for y'all, but I kinda, Should I do Wiley? Okay, let's do Wiley. Wiley has something called, this is so not funny. Wiley has something called the 1.5 syndrome. 1.5. Like, this shit, you can't make this shit up. When I say you cannot make this shit up, the 1.5 syndrome, okay? You cannot make this shit up. I'm dead. It's a rare weakness. Wild eye syndrome. But I swear to God, look. They got something called the... Hold up. Because I swear to God. Oh, it's called 8.5 syndrome. I was like, what the fuck? Right now, he got the 1.5. You know, one eye straight, the other one is going that way. I'm not picking at my face. Somebody text me. My bad. But, how sway? And she must not been that big, honey. She wasn't as big as she is, but her body her body started rejecting the insulin and coming from the food, so she got big. And she like, no one is really giving her the, you know, help on how to lose weight. And I'm trying to explain to her, like, it's not you, it's your body. You can do any and everything that you can to lose weight, but it will not happen because the insulin in your body is rejecting it. So you're going to constantly lose weight. Throwing up ain't going to help. You need to really change everything going on in your life. Now, Wiley have the 1.5 syndrome, right? And I'm trying to... Okay. You can't make this shit up, okay? The 1.5 syndrome, okay? This is what Wiley has. I just want y'all to know ain't no fucking way, okay, bitch? It's no way you can be that big and that discreet. In a laundry room, girl, it better have been your laundry room. I know you weren't on top of the motherfucking dryer or the washer, bitch, because you're too big for that. I'm pretty sure half of your body was on and half of your body was off. Nigga probably was telling your bitch, just lay on the floor. Just lay on the floor. Ain't nobody got time for all that. Wild eye syndrome. Let me see. Before I do this 1.5 syndrome, let me see. Y'all know I be looking up any and everything. Bitch. Good morning. No. They call it, nope. Nope, we got the 1.5 syndrome. Wild eye syndrome ain't. That's for people with doll babies and shit. Yeah. Okay. But this popped up for wild eye syndrome. Child, for days. Y'all don't see this? Bitch. That's why I keep picking on it, cause like, when you got a face like mine's, motherfucker, you anything on that motherfucking face kills. Okay, it's called hypertelorism. Okay.
Where the charger thing at?
Over here. I was using it. I'm not using it right now.
I need my charger.
You leaving?
Yeah.
Go. I wasn't
I'm
using it.
clean my tank out, put my new fish in
Well, where the fuck is the fish?
in my hand.
Oh, let me see. Ooh, look at the motherfucker. Like, here. Alright, so we got hypertelorism, which came up for wild eye syndrome, actually. So let's do both of them. 1.5 syndrome is a rare weakness in eye movement affecting both eyes, in which cannot move laterally at all, and therefore only the other can only move in the outward direction. Okay, you can't make this up. Diagnosis, symptoms, and causes. Symptoms: visual impairment, impaired swallowing, and fine motor deficiencies may contribute to locating the lesion. Causes: hemorrhaging, tumors, infective mass lesions, meaning tuberculosis, or multiple sclerosis. The only way to fix it, diagnosing, A spectrum disorder rely on distinctive clinical symptoms, neuroanatomy, especially imaging technologies. Treatment is something called, I don't fucking know.
Sydney, what are you doing?
Toxin injections. Alright.
Think that's funny, right?
I need more what?
Give me a second, y'all.
Alright. Thinking it's funny.
I need more what?
Shut up.
Shut up. You shouldn't be up. It's hot as shit. Oh, that ham smell good. Okay. Well, you saying you hate me, but I'm saying they was, listen, this the fucking emergency room. They was running rapid yesterday. Niggas got knocked the fuck upside their head and shit. I'm just trying to help. Niggas stepped into my fucking emergency room. Niggas called me last night like, doctor, we need you. Doctor, we need you. And doctor is here. Hypertelorism is an abnormally decreased distance between two organs or bodily parts usually referring to an increased distance between the orbits, meaning the eyes. Okay? Or orbital hypertelorism. In this condition, the distance between the inner eye corners as well as the distance between the pupils is greater than normal. Hypertelorism should not be confused with, let's see, what is that? Nope, it's not that. Okay. Okay. They got a lot of fucking syndromes that's associated with this shit. That's how I find my shit. Because, y'all see this? That's how all that blue shit is connected to this one motherfucking thing. Syndromes. Syndromes. The Edward syndrome. This is real. Okay? Alright. Who next? I did Tracy. Brianna. Alright, y'all. Definition. Now, see, there was no such thing as a baby bop syndrome. Okay? And I did definitely looked it up. Okay? You can't make this shit up. And I'm going to help y'all with this. Because I heard y'all calling Harley Q baby bop. Okay? I heard y'all call Harley Q this. So, baby bop syndrome is... Yes. Baby bop syndrome. I am fucking dead. Okay? Now, when I tell y'all you can't make this shit up, I am fucking dead. There's no such thing. It's such thing as a baby bop syndrome, but it deals with chemotherapy, cancer, and all that. So, I just found the definition of baby bop. What'd that say? Baby bop. Barney's bitch. It say that Barney says, baby bop, you satisfy all of my sexual needs in front of terrified children. Hence, you are my bitch. I said, ooh, that's deep. Yes. I said, oh, that's real deep. Real deep. Okay.
Who just said this?
I'm not sure. What is it?
It's a damn.
glove.
Wet ass glove.
But then it says baby bop. Definition number 2 for baby bop. One who is jealous, green with envy. They try to be on your level of greatness, but they suck too much to ever accomplish such a feat. Really? Baby bop. That's how y'all feel about Harley Q. She's a baby bop. I'm dead.
Running.
Why are you smacking like that? Yeah, that's the only thing I could find for baby bop syndrome. It really wasn't. Stop the fucking bullshit. Stop the fucking bullshit. Y'all know I just read and read. But that's all I'm going to give y'all today. I got a special drive if somebody come on here and say something. But don't take this from me. Just take my advice. Don't come for daughter. Daughter was doing her job. I hope y'all stepped into the emergency room. I got to get off because I got other shit to do. And I wasn't supposed to be on even this long. I was on for an hour. That's good enough. I only come in for an hour. Thank you, Dr.Dawta did her motherfucking thing. Oh, okay. I take that. Because none of this shit is to me. Okay? I don't give a fuck what none of y'all say. I got the unicorn syndrome. None of this shit. None of this shit goes to me. I don't think any of these motherfucking syndromes are nothing. The shit that I do. You said come back tomorrow? Well, I need some people that I need to diagnose. Just give me a list of those that need to be diagnosed. And I got y'all. Y'all know a bitch bring out the motherfucking pen. The motherfucking pen. I got... Oh no. I got a couple people I can do. Oh yes, I do. I can come back tomorrow. I wasn't. Alright. And actually, excuse. Actually, I already got their symptoms. And I already got their diagnosis in my phone. Okay, you want me to put her on the list? They want 5A. Okay. 5A. Anybody else? Okay, we got Rita. Okay, we're going to do Rita. 5A. Oh, I'm trying to figure out why she keep doing this. We'll figure it out. I got y'all. Trust me. Y'all know I hit it on the nose. Y'all is a mess on here. I'm going to start doing... I'm gonna start doing some trolls. I got you, bitches. I'm gonna do some trolls. First troll. Ah. Oh, hey, mama sipping. I'm gonna do some fucking trolls. Y'all think it's a game? I'm gonna do some fucking trolls for y'all because these trolls is out of fucking pocket. Okay. So what I'm gonna do is I'm gonna do 3 content. I'm gonna do first of all, Lord, just be my peace. Child. You're a master troller. Key you first. I got one for you. And you better not get mad. I'm gonna have to go look it up. What the fuck is that noise? Oh, that's Demurray's.
What?
Okay, you said you want me to do you too? TT, alright. This the one that's the doctor. Fake ass doctor. Alright. I got you. This is okay. Oh, you can't wait? Okay, so I'm gonna do 2 and 2. I'm gonna do 2 and 2. 2 content creators and 2 trolls. Alright, I got y'all. I'm so serious. I'm gonna do okay. I'm doing everybody now. I'm gonna do every motherfucking body. Every content creator. Every fucking troll. Look. I diagnosed myself already, so don't be mad.
Brittany,
What?
can you reach this for me?
Why y'all think I'm like the tallest person around when I'm only 5'3"?
I'm damn 5'3".
That's the fuck I am, nigga.
You know damn 5'3". The macaroni. You hear her lying ass?
I am so. What are you talking about?
I'm 5'3".
Demurray's, man, you the same height.
Ma, she's not gonna get
Yo,
5'3".
such a fucking ass. Demurray's, you got boots on your feet, Doug.
With boots off, I'm still 5'3". I'm taller than mommy.
I'm taller than Dawn.
That makes you 5.
What are you talking about?
2.
Well, you just want me. You said that makes you 5'2".
Nigga be so close to you about 4'11". 4'11".
4'11". Oh, dwarfism.
Yeah. Who dwarfism?
You.
Some type of dwarfism.
Who got some type of dwarfism? Oh. I'm a diagnosed mama sipping. She got dwarfism going on.
Mm-hmm.
Suck your dwarfism dick. What? That means your dick little. I'm just gonna throw that out there. Oh God, I am so over y'all. I've done my job. I had a great time on here.
People across the hallway moved out. Ma.
I don't mean no harm, but you got some people that would take it to heart because it hit a nerve. And I don't mean to hit a nerve, but sometimes I just be on point with some shit and, you know, ain't got shit to do with me. Ain't got shit to do with me. I had fun on here, y'all. Please thumbs up this video. That's how you supposed to do it.
Oh. Oh. So you doing it? Yeah, you are.
What?
How I came? No. There you are.
Throwing down?
No, you doing it. You doing what? You how I just came out not bad. days. 3 days.
2
2 days. Remember that. I'm counting. I'm not with none of that. You not with none of what? I ain't with that. Nigga will get this motherfucking.
Yo dumb as shit.
So you gonna kill me if I don't cook?
But y'all, I'm getting off of here. I don't really have too much to talk about. I don't want to jump into somebody's ass. I mean, listen, Key. At some point, you can call it doxing because it hit a nerve. But I don't go in your background. I just look at you and be like, "Well, this is wrong with you.
That's how they do it.
Welcome to the book." But once it hit a nerve, then they consider it doxing, and that's when the fuck they go off on me. But I just write your name down. I'd be like, okay, this bitch got a little ass head. Let me go look up little head syndrome. Like, that's what I do. I don't go into too much. Like, Mom, where your phone go? Like, I'm going to show you an example.
Damn, why you not use my
Okay, because my iPhone not working.
phone?
Let me show y'all, right?
My phone ain't for the TV. Alright. I'm going back and finish doing what I'm doing. Tidy this living room up now. Put everything back. No. No. Yeah.
Fuck no. Alright, so look. Listen. All I did, I'm going to tell y'all what I typed in, okay? Someone, and I want y'all to go do it. This is how I do it. Someone who talks excessively is a what? Go. Somebody tell me who talks excess. Someone who talks excessively is a what? I'm going to show y'all how I do it. Yes, Miss Diva. You? Okay, Key. Let's go ahead and get you out the way. This is really fun, y'all. Alright, so you are something called a what? Motor mouth. Now, what is motor mouth syndrome? I swear to God, you can't make this shit up. Motor mouth syndrome. I am fucking dead. Motor mouth syndrome is when you or someone involved in a supposed conversation cannot stop talking to the point that the other person has great difficulty getting any words into the conversation. The conversation is one-sided as a result. Key, this is you. But there's different motor mouths. RTT. There's different motor mouths. But Key, I'll save that for you later. I'm gonna get into it with your ass. Okay. Disclaimer, this is all for educational use. Let me see. Is there such, okay. Flip. Syndrome. Okay, so it's not called that. Let's go a different way. I got you. Nope. 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 I don't know. I would have to go get into it. Y'all think I'm playing? Who asked that? That's what I'm gonna come on. I'm gonna find that one out for you tomorrow, Miss Diva. Which we say a flip-flopping syndrome. Well, I'm getting off of here anyway because I got another appointment, okay? I've done my job. I hope you motherfuckers had fun. And I gotta get out here. I'm clocking out. Absolutely. Put my shit away. And y'all, have a good day. Absolutely. Now I know somebody that's gonna come on here and try to give me the run for my money, but I have a couple disorders for that ass too. I'll talk to y'all later. Like this video. Thumbs up or thumbs down. Daughter really don't care. See y'all. Oh, who is that? Who is that?